Having an on-site fuel source does not prevent the use of natural gas for generators in healthcare facilities. Natural gas qualifies as an on-site fuel source if stored on the facility's property. The National Electrical Code, or NEC, mandates that healthcare facilities have emergency generators that can supply power to essential equipment during power outages. These generators must have an on-site fuel source to operate independently from the utility grid. Natural gas is a frequent fuel choice for healthcare facility generators due to its accessibility, reliability, and cleaner combustion properties. It can be stored on site in tanks or cylinders, offering a secure and easily accessible fuel supply. However, the NEC has specific guidelines for the installation and operation of natural gas generators in healthcare facilities. These guidelines aim to reduce the risk of fire or explosion and ensure the generator's safe operation. When designing and installing a natural gas generator system, several factors must be considered to comply with the NEC and other relevant codes and standards. Firstly, fuel storage is paramount. The NEC outlines requirements for the size, type, and location of natural gas storage tanks or cylinders. The storage system must meet pressure and safety standards, including proper ventilation and leak detection systems. Secondly, the NEC specifies the installation requirements for natural gas piping and connections to the generator. The piping must be sized appropriately to deliver adequate fuel flow to the generator under all operating conditions. It should be constructed of approved materials and installed according to applicable codes and standards. Thirdly, generator installation plays a crucial role. The NEC mandates specific clearances around the generator for maintenance and ventilation. The generator must be installed on a level surface and adequately supported to prevent vibration and movement. Fourthly, ventilation is critical. Natural gas generators produce exhaust gases that must be properly vented to the outside. The NEC outlines requirements for exhaust systems, including the size, materials, and location of exhaust stacks. The exhaust system must be designed to prevent the accumulation of exhaust gases inside the building. Fifthly, safety controls are essential. The NEC requires natural gas generators to have various safety controls, including overspeed protection, over-temperature protection, and low fuel shutdown. These controls are designed to protect the generator from damage and prevent hazardous conditions. Sixthly, regular testing and maintenance are imperative. The NEC mandates that natural gas generators be tested and maintained regularly to ensure their proper operation. This includes inspecting the fuel storage system, piping, connections, and safety controls. It also includes performing load bank testing to verify the generator's ability to supply power under load. Now, let us consider the NEC articles that are relevant to generators. NEC Article 700 covers emergency systems, which are essential for healthcare facilities. This article provides requirements for the design, installation, and testing of emergency power systems, including generators. NEC Article 701 covers legally required standby systems. These systems are required by law or regulation to provide power to specific equipment or loads. This article provides requirements for the design, installation, and testing of legally required standby systems, including generators. NEC Article 702 covers optional standby systems. These systems are not required by law or regulation, but are installed to provide power to non-essential equipment or loads. This article provides requirements for the design, installation, and testing of optional standby systems, including generators. It is important to understand the types of loads that an emergency generator in a healthcare facility must serve. Essential electrical systems in healthcare facilities are categorized into three critical branches: life safety, critical, and equipment. Firstly, the life safety branch supplies power to systems essential for the safety of patients and staff during an emergency. This includes emergency lighting, fire alarm systems, and communication systems. Secondly, the critical branch provides power to critical care areas such as operating rooms, intensive care units, and cardiac care units. This branch ensures the continuous operation of essential medical equipment and life support systems. Thirdly, the equipment branch supplies power to equipment necessary for the safe and effective operation of the healthcare facility. This includes heating, ventilation, and air conditioning, HVAC systems, medical gas systems, and laboratory equipment. The NEC provides specific requirements for the wiring and protection of each branch to ensure reliability and safety. Automatic transfer switches, or ATS, are a critical component of emergency power systems. An ATS automatically transfers the load from the normal power source to the emergency power source, such as a generator, when a power outage occurs. The NEC requires that ATS be installed in emergency and legally required standby systems to ensure a seamless transfer of power. ATS must be listed and labeled for their intended use and must be installed according to the manufacturer's instructions. The selection of the appropriate size and type of generator for a healthcare facility depends on several factors, including the size of the facility, the types of loads to be served, and the available fuel source. The generator must be sized to meet the peak demand of the essential electrical systems. It should also have sufficient capacity to handle any future expansion of the facility. The type of generator should be selected based on the available fuel source and the specific requirements of the facility. Natural gas generators are a popular choice for healthcare facilities due to their reliability and relatively clean operation. Fuel storage and handling requirements are critical considerations for natural gas generators. The NEC provides specific requirements for the storage, handling, and distribution of natural gas to minimize the risk of fire or explosion. Natural gas storage tanks must be located in a safe area away from potential hazards. They must be properly vented and equipped with safety devices, such as pressure relief valves and shut-off valves. The natural gas piping system must be designed and installed to prevent leaks and ensure a reliable supply of fuel to the generator. Regular inspections and maintenance are essential to ensure the safe and reliable operation of the natural gas fuel system. Coordination with local utilities is essential when installing a natural gas generator in a healthcare facility. The local utility company must be notified of the installation to ensure that the generator is properly integrated into the utility grid. The utility company may also have specific requirements for the generator's operation, such as limitations on the amount of power that can be exported to the grid. Coordination with the utility company can help ensure that the generator operates safely and efficiently without interfering with the utility grid. In summary, using natural gas as an on-site fuel source for generators in healthcare facilities is acceptable under the NEC, provided that the gas is stored on the premises and all relevant safety and installation requirements are met. Careful planning, design, and coordination with local utilities are essential to ensure the safe and reliable operation of the generator system. Adherence to NEC guidelines is paramount for safety and compliance. Now let us consider further specifics with respect to NEC articles that apply to generator installation and maintenance. NEC Section 517.30 covers essential electrical systems for healthcare facilities. This section defines the different types of essential electrical systems and outlines the requirements for their installation and operation. It emphasizes the importance of reliability and safety in healthcare settings. NEC Section 517.35 details the essential electrical systems for hospitals. This section provides specific requirements for the life safety critical and equipment branches in hospitals. It addresses issues such as transfer switch operation, generator sizing, and wiring methods. NEC Section 700.3 covers the tests and maintenance for emergency systems. It states emergency systems, including generators, must be tested periodically to ensure their proper operation. This includes regular inspections, load bank tests, and maintenance procedures. NEC Section 445.11 talks about the overcurrent protection for generators. Generators must be protected from overcurrent conditions such as short circuits and overloads. This section outlines the requirements for overcurrent protection devices such as circuit breakers and fuses. NEC Section 445.12 explains generator disconnecting means. Generators must have a disconnecting means to allow for safe isolation from the electrical system. This section outlines the requirements for the location and type of disconnecting means. NEC Section 445.13 details generator wiring methods. Wiring methods for generators must comply with the requirements of Chapter 3 of the NEC. This chapter covers the types of wiring methods allowed, conductor sizing, and installation requirements. NEC Section 445.14 states generator location. Generators must be located in a well-ventilated area that is protected from the elements. This section outlines the requirements for generator room construction, ventilation, and access. NEC Section 445.17 talks about the surge protection. Generators can be susceptible to damage from voltage surges. This section outlines the requirements for surge protection devices, such as surge arresters and TV assessors. NEC Section 445.18 details the accessibility. Generators must be accessible for maintenance and repair. This section outlines the requirements for access panels, walkways, and working space. NEC Section 445.20 explains the grounding. Generators must be properly grounded to protect against electrical shock hazards. This section outlines the requirements for grounding electrode systems, grounding conductors, and bonding. Moving on to the design considerations for generator systems, we should consider the ambient temperature. Generators are typically rated for operation at a specific ambient temperature. It is important to consider the ambient temperature at the generator's location to ensure that it can operate properly. If the ambient temperature is too high, the generator may need to be derated. Generator altitude also needs consideration. Generators are also affected by altitude. At higher altitudes, the air is thinner, which reduces the generator's output. It is important to consider the altitude at the generator's location to ensure that it can meet the load requirements. Harmonic distortion is something to consider. Generators can produce harmonic distortion, which can affect the performance of other electrical equipment. It is important to consider the potential for harmonic distortion when selecting and installing a generator. Vibration isolation is something to consider as well. Generators can produce vibration, which can be transmitted to the building structure. It is important to isolate the generator from the building structure to prevent noise and vibration problems. Noise attenuation is something to think about. Generators can produce noise, which can be a nuisance to building occupants. It is important to attenuate the noise from the generator to minimize its impact on the surrounding environment. Exhaust emissions should also be considered. Generators produce exhaust emissions, which can be harmful to the environment. It is important to consider the exhaust emissions from the generator when selecting and installing a generator. Make sure that all local, state, and federal regulations are followed. Remote monitoring is something to think about too. Generators can be monitored remotely to track their performance and identify potential problems. Remote monitoring can help to ensure that the generator is operating properly and can prevent costly downtime. Load shedding can also be incorporated. Load shedding is a technique that can be used to reduce the load on the generator during a power outage. Load shedding can help to extend the generator's runtime and prevent it from overloading. Paralleling generators is another option. Paralleling generators can provide increased capacity and redundancy. Paralleling generators requires careful coordination and control to ensure that they operate properly. Considering the cost of installation is very important. The cost of installing a generator can vary depending on the size and type of generator, the location of the generator, and the complexity of the installation. It is important to obtain quotes from several contractors before selecting a contractor to install the generator. The maintenance cost is something to consider as well. Generators require regular maintenance to ensure that they operate properly. The cost of maintenance can vary depending on the size and type of generator and the frequency of maintenance. It is important to factor in the cost of maintenance when evaluating the overall cost of ownership of a generator. Here are some additional points to consider when using natural gas generators in healthcare facilities. Natural gas generators are typically less expensive to operate than diesel generators. Natural gas is a cleaner burning fuel than diesel, which results in lower emissions. Natural gas generators are typically quieter than diesel generators. Natural gas generators require a connection to a natural gas pipeline, which may not be available in all locations. Natural gas generators are subject to the availability and reliability of the natural gas supply. Now, regarding the specifics of the NEC requirements, it's crucial to understand how they apply to generator installations in healthcare facilities. Firstly, Article 517 addresses healthcare facilities. It provides specific requirements for electrical systems in hospitals, nursing homes, and other healthcare facilities. This includes emergency power systems, which are essential for maintaining patient care during power outages. Secondly, Article 700 covers emergency systems. It outlines the requirements for emergency electrical systems, including generators, transfer switches, and distribution equipment. This article specifies the performance criteria for emergency systems, such as the time required to start and transfer power. Thirdly, Article 701 covers legally required standby systems. It addresses systems that are legally required to provide power to specific loads, such as fire pumps or elevators. This article specifies the requirements for these systems, including the type of equipment required and the performance criteria. Fourthly, Article 702 covers optional standby systems. It applies to systems that are installed to provide power to non-essential loads such as comfort lighting or convenience outlets. This article specifies the requirements for these systems, including the type of equipment required and the installation methods. Now let us dive deeper into specific NEC sections that are highly relevant. Firstly, NEC 517.30 details the essential electrical systems. It classifies essential electrical systems into three categories: life safety, critical, and equipment branches. This section outlines the requirements for each branch, including the loads they must serve and the wiring methods required. Secondly, NEC 517.35 explains the essential electrical systems for hospitals. It provides specific requirements for hospital electrical systems, including the number and type of generators required, the location of transfer switches, and the wiring methods allowed. Thirdly, NEC 700.12 outlines the generator set location. It specifies the requirements for the location of emergency generators, including the need for adequate ventilation, protection from the elements, and accessibility for maintenance. Fourthly, NEC 700.12 details the generator set size. It requires that emergency generators be sized to carry the full load of the essential electrical system. This section provides guidance on calculating the load and selecting the appropriate generator size. Fifthly, NEC 700.12 covers the generator set fuel supply. It specifies the requirements for the fuel supply for emergency generators, including the type of fuel allowed, the amount of fuel required, and the location of fuel storage tanks. Sixthly, NEC 700.12 explains the generator set transfer equipment. It requires that emergency generators be equipped with automatic transfer switches that will automatically transfer power from the normal source to the generator in the event of a power outage. This section provides guidance on selecting and installing transfer switches. Seventhly, NEC 700.12 details the generator set testing. It requires that emergency generators be tested regularly to ensure that they will operate properly in the event of a power outage. This section provides guidance on performing generator tests. Eighthly, NEC 700.12 covers the generator set maintenance. It requires that emergency generators be maintained regularly to ensure that they will operate properly in the event of a power outage. This section provides guidance on performing generator maintenance. Let's explore some practical considerations for natural gas generator installations. Firstly, fuel supply reliability is paramount. Ensure reliable natural gas supply, considering potential interruptions or curtailments. Work with a local utility to assess the capacity and reliability of the gas supply. Secondly, gas pressure regulation is key. Properly regulate the gas pressure to meet the generator's requirements. Install a pressure regulator to maintain a consistent gas pressure. Thirdly, ventilation is essential. Provide adequate ventilation for the generator to prevent the accumulation of combustible gases. Follow the manufacturer's recommendations for ventilation requirements. Fourthly, exhaust system design is important. Design the exhaust system to safely vent exhaust gases away from the building and occupied areas. Comply with local codes and regulations for exhaust system design. Fifthly, safety controls are crucial. Implement safety controls to protect the generator and prevent hazardous conditions. Install overspeed protection, over-temperature protection, and low fuel shutdown. Sixthly, regular maintenance is necessary. Perform regular maintenance to ensure the generator's reliable operation. Follow the manufacturer's recommendations for maintenance intervals and procedures. Seventhly, load testing is important. Conduct load testing to verify the generator's ability to supply power under load. Perform load testing at regular intervals to ensure continued performance. Eighthly, coordination with utilities is key. Coordinate with the local utility to ensure proper integration of the generator with the grid. Comply with the utility's requirements for interconnection and operation. Remember, consulting with qualified engineers and contractors is essential for the safe and compliant installation of natural gas generators in healthcare facilities. By adhering to the NEC and following best practices, you can ensure a reliable emergency power supply that protects patients and staff during power outages. Furthermore, it's essential to understand the specific nuances of healthcare facility electrical systems. Healthcare facilities have unique electrical requirements due to the critical nature of the services they provide. Emergency power systems must be designed and installed to ensure the continuous operation of essential equipment and systems during power outages. This includes life support equipment, medical imaging devices, and critical care areas. The NEC provides specific requirements for healthcare facility electrical systems to ensure patient safety and the continuity of care. These requirements address issues such as grounding, wiring methods, and the separation of essential and non-essential circuits. Additionally, healthcare facilities must comply with other codes and standards, such as those established by the Joint Commission and the Centers for Medicare and Medicaid Services. These organizations set standards for healthcare facility operations, including electrical system maintenance and testing. To ensure compliance with these requirements, healthcare facilities should work with qualified electrical engineers and contractors who have experience in healthcare electrical systems. These professionals can help to design, install, and maintain electrical systems that meet the unique needs of healthcare facilities and ensure patient safety.